Welcome to tonight's talk, Supporting the Elder Brain Health. My name is Bryce Pickard, and I'm the Senior Vice President and Chief Operating Officer at the Ontario Brain Institute, or OBI for short. On behalf of our organization, I would like to acknowledge that the OBI office and the BMO Education and Conference Center are located on Toronto, the Indigenous name for Toronto, meaning the place in the water where the trees are standing. We are inhabiting the traditional territories of many Indigenous nations, including Mississauga of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat people, which are now home to many diverse First Nations, Inuit, and Métis peoples. These lands have been under the care of Indigenous communities for millennia, and we are grateful to gather, learn, and live on this land. As an organization focused on brain health, we have learned a great deal from the Indigenous ways of knowing, particularly about holistic health. Indigenous cultures emphasize the interconnection between mental, physical, spiritual, and emotional well-being. This notion fits well with today's topic of supporting the elder brain. I recently had the pleasure of joining the OBI team. In fact, at the end of this month, it will mark my first 100 days in the office. And what an exciting first few months it's been. As many of you will know, the end of 100 days is when you're not allowed to say, hey, I'm just the new guy, what do I know? Which is a problem because I am really just trying to keep up with everyone. You see, within OBI and among our partner institutions, we have 52 partner organizations, over 162 researchers, and more than 105 portfolio companies. We are a group of tremendously talented and dedicated individuals who want nothing more than to help the 1 in 3 individuals impacted by a brain disorder, whether this be the person living with the disorder or their family, friends, caregivers, or advocates. Not only that, we are at an inflection point with technology is poised to revolutionize how we understand, diagnose, and treat brain disorders. With advancements in AI, big data, and precision medicine, we have a unique opportunity to bridge the gap between research and patient care. We need to ensure that innovations translate into meaningful improvements in patient care and quality of life. And there's more, and as you will hear from our panel tonight, there is no one-size-fits-all approach to improving and maintaining brain health as we age. And this is due in large part to the fact that the brain extends much further than just the organ between our 2 ears. It's tied to our environment, relationships, and every meaningful engagement with the world around us. And this is one of the main reasons why over the past 10 years, OBI has hosted close to 40 public talks featuring experts in neuroscience and brain health. And like many of the things we do in OBI, we do not do it alone. So we would like to thank our sponsor for tonight, the Weston Family Foundation. These conversations tonight and the other public talks are really meant to educate, inform, and empower you with knowledge about brain health, drawing from the latest advancements in research and care. So tonight, thank you very much for joining us. I'd now like to introduce tonight's moderator, Farah Kaiser. A genomics researcher by training, Farah holds a Master's of Science in Molecular Genetics from the University of Toronto, where she carried out genome sequencing to better understand neurological disorders. Outside the lab, Farah has written about science for various media outlets, served on the Canada Chief Science Advisor Inaugural Youth Council, and co-authored a children's picture book in 2004 titled Kaduja and the Elephant Toothpaste Experiment. She was recently recognized for her contributions towards fostering science culture in Canada through a King Charles III Coronation Medal. Farah, welcome.
Awesome. Thank you for that kind introduction. As moderator tonight, I'll be facilitating about half an hour to 45 minutes of conversation with our 3 incredible panelists tonight, and then we'll be taking audience questions. So for people who are tuning in through the live stream, to send us questions, please use the chat function on the right side, or you can email us at communications@braininstitute.ca. So that's communications@braininstitute.ca. For folks who are here in person, you can raise your hand, and then one of the folks here who are working with the OBI team who will be waving their hands. They can offer you a pen and paper so you can jot down your questions. All the questions are being funneled through the OBI team, including Jordan here in the front. They'll be sent over to us, and we're going to try to get through as many questions as we can tonight, but bear with us. There are generally a lot of questions and not enough time. And with that, I'm going to introduce our panelists one by one. So our first panelist tonight is Ngozi Iroanyah, who is a PhD candidate and the Director of Health Equity and Access at the Alzheimer Society of Ontario, working in the field of health equity as a strategist, policy analyst, and community engagement practitioner. Ngozi implements an intersectional lens as the foundation of her professional and academic work to support equity-deserving communities to achieve better health status in the dementia space. Now, I always like sharing a fun fact about all our panelists, so I don't want to spoil this, but Ngozi gave a talk last year at the TEDxTMU, the Toronto Metropolitan University. I would recommend you take a look at it and you listen to it because it's sort of a cultural perspective on how you provide care to people in your life who may be living with cognitive impairment and dementia. So I will hold it there, but definitely check out that TEDx talk. Our second panelist tonight is Dr. Laura Middleton. Dr. Laura Middleton is an associate professor and the Schlegel Research Chair in Dementia and Active Living at the University of Waterloo and the Schlegel UW Research Institute for Aging, with a focus on the role of physical activity and complementary lifestyle strategies. Laura's research aims to identify strategies to promote well-being and independence of those living with or at risk for dementia. My fun fact is that her lab is actually called the Brain and Body Lab, which is a really great name. And again, definitely check out her lab, but one of the projects that I was reading about was called the DREAM Project, which was actually focused on providing learning modules for people who are providing care. So it's community practitioners to help adapt the programs that they already have for people who are living with dementia. So I like that it's really focusing on the people who are working and providing the program. So yeah, welcome, Laura.
Thank you.
And last but not least, we have Dr. Dominik Nowak, who is the president of the Ontario Medical Association, a family doctor at the Women's College Hospital, and a faculty member at the University of Toronto's Department of Family and Community Medicine, as well as the Dalla Lana School of Public Health. He is also the recipient of the College of Family Physicians of Canada Award for Excellence for his leadership in Canadian healthcare. And I already warned him what his fun fact would be, which was he's actually the youngest president of the Ontario Medical Association in its entire 143-year history. So that's incredible. Yeah. But welcome to all of our panelists. Thank you for joining us tonight. I'm sure I speak for everyone here when I say that we're very keen to hear your different points of view about cognitive well-being, about social prescribing, and sort of the lifestyle strategies for brain health. Before we begin, I do want to mention, what is cognitive well-being? Because it's a bit of a heavier term, and what does it mean? Well, it really refers to sort of the health and performance of your brain. So it's thinking about areas such as memory, problem solving, decision making, and attention. And good cognitive health isn't just about the absence of a mental health disorder or the absence of cognitive impairment, but it's also about maintaining a high level of cognitive well-being and being able to sort of maintain an overall sense of mental clarity and agility. So that's sort of what we're talking about when we're talking about cognitive well-being. And interestingly enough, there was a recent brain health survey from the Ontario Brain Institute, which found that older adults are concerned about their brain health, specifically cognitive function and memory. They're looking for actionable tips and supports, especially those supports that are close to home when it comes to their brain health. And as Bryce mentioned in the beginning, there's no one-size-fits-all treatment or prescription for this. So I'm really hopeful that tonight our speakers are going to help us share some nuggets of wisdom to figure out how can we manage our brain health with or without a brain disorder. So we're going to dive straight in with the first question to Laura. So let's start by grounding this talk in what we know about the research from aging. So based on your experience and the work that you're doing with people living with dementia and other forms of cognitive impairment, what is the difference between normal cognitive aging and cognitive impairment? And at what point does someone seek help?
Yeah. Thank you so much, Farah. And for all of you for being here. I do a number of public talks, as Ngozi and Dominik do as well. And I'd say this is the most common question that I get is, how do I know if I have cognitive impairment? And the first thing I'd say is lots of people get worried because they've lost their keys, because they forgot what they did a couple days ago, because they've put the cereal in the wrong cupboard, whatever it is. that is not cognitive impairment, right? My kids do that, I do that, I'm sure these guys do that. That is normal, and you just start worrying about it when you're older because you're worried about dementia. There are some changes that occur with age that are also not dementia. The most notable one is a change in what we call processing speed. And that means that you're not necessarily having major differences in memory or decision making, but you do it a little bit slower. So you can remember it, but it takes you longer. You can't make a snap decision as quickly or refocus your attention. So it just is taking you a little longer. And again, that's not a sign of dementia. That is just some of that neural slowing just occurs with age. I'd say by definition, what dementia is when you're experiencing cognitive changes that are significant enough that they're affecting your daily living, whether that's a job if you're still working, whether that's managing your bills, whether that's cooking a really complex meal or participating in your meaningful activities. That's when you want to start paying attention and seeking help. One example from memory is that I talk about that kind of tells the difference. You know, all the time we forget what we might have done a few days ago or last week. But if someone prompts you, they say, oh, don't you remember we went to lunch at this restaurant? If that still doesn't feel familiar after the prompting, you should be concerned, right? But if you're prompted and you say, oh, right, I just forgot, then you're probably fine, right? Those are some differences. I think the second thing, and this is a little bit beyond your question, Farah, but when people are truly experiencing, some of those concerns, they're often, a fear of going for an assessment and getting a diagnosis because there's a lot of stigma around dementia. So people live with that fear themselves and don't get the assessment. And I really encourage everyone to go in, and that's for a couple reasons. One, cognitive impairment can be caused by a lot of things. So while dementia is hard to treat, it can be due to an infection, it can be due to your medications, it can be due to a tumor, all sorts of different things, and you want to really know the basis for that. And the second thing is, by getting that diagnosis, you get access to resources, you have the opportunity to participate in programs where other people are living with the condition, and it helps take away some of that fear. When we think about that, fear is grounded in the end stages of dementia. But the early stages are not that much different. You can live well for a period of time with dementia. And the people you see and you can recognize are later stage, but there's people in this audience who have dementia and you would never know. And so, getting that, being comfortable with it, leaving open with it means that you can take those steps to live well as long as possible. And the good news is the things that help you live well are the same things as you do to prevent dementia. Being physically active, getting out and socializing, learning new things, taking care of your vascular health. Those are the things that are going to help you live well as long as possible with dementia, be independent as long as possible. And that can happen. I know we have this idea of the end stage, but people live well with dementia for years. And with your knowledge and the support of those around you, that's a reality too.
So I think one of the key things we're taking away is everyone forgets things time to time, but it's really when the prompts aren't helping you recall.
That's right.
That's maybe the time to start going to see a doctor. Well, speaking of doctors, Dominik. So as an active physician and someone who's worked with and met with thousands of doctors and patients and concerned citizens as OMA president, what are you seeing as a family doctor in terms of healthy aging in our health system?
Yeah, you know what? I'll start with this. Raise your hand if you have a family doctor in this room. Yeah, a lot of us here. I'd say this room is not representative of the reality that people are facing. Yeah. So we're I'd say, a privileged room when it comes to access to healthcare. And the number one thing that determines how you interact with the healthcare system is whether you have a family doctor or not. By far, that's the number one thing. And I remember some time ago meeting with someone who, like many people, like 1 in 4 people nearly in Ontario, hasn't been able to find a family doctor. This person hadn't been able to find one in over 6 years. They were bouncing around hospitals, emergency rooms, walk-in clinics, pharmacies, just trying to do what they can to get care. And this is the living reality for so many people in Ontario. And they ended up having a delayed, serious, avoidable breast cancer diagnosis in the emergency room, right? So it's no surprise that having a family doctor is that number one piece for how you experience healthcare and is so important to aging when you think of vascular health, preventions, avoiding emergency room visits, doing things proactively, keeping up on your cancer screening, all these different things. And by the way, it makes your care less expensive for taxpayers and for the healthcare system if you have a family doctor. So we end up making it more sustainable to have a strong Canadian healthcare system when we connect everyone to a family doc. That's why this matters. That's why we're seeing connection to family doctor as a big part in the media right now, in advocacy to government. And that's why if you can't find a family doctor, one, it's so important. Two, tell people to call their elected officials, right? Really, provincially, our elected officials are responsible for getting us a family doctor and keeping our healthcare system at a place where we can rely on it. And that starts with that foundation of having a family doctor.
So for people who are keeping a to-do list, we are currently making sure we're staying healthy with exercise, we're eating well, we're taking care of vascular health, we're getting a family doctor, or we're advocating for everyone to get one. So just in case you're taking notes, it's going to be a long to-do list. My next question is for Ngozi. So picking up on this idea of community, you've got both personal and professional experience in the healthcare system, especially in navigating how complex it can be. So as many of us know, most of the aging is actually happening outside of the doctor's office in the community. What supports and services can people find in communities?
Yeah, this question is super important for a lot of people. Accessing healthcare services formally for people living with dementia can be a minefield. I've been in this business for a very long time professionally. I've been living with dementia in my home for about 17 years. And even with all I know, I still run into roadblocks trying to figure out who to call, when, et cetera, and what to look for. I will say, though, there is help. And I work for the Alzheimer Society of Ontario, and we have societies throughout the whole province. And that typically is the first point of contact after you get the diagnosis from your doctor. They will refer you to the Alzheimer's Society in your local catchment area. And at the Alzheimer's Society, wherever you are in the province and the country writ large, you can access activation programs, Minds in Motion, socialization programs. You can access counseling support. You can access support groups as well. There's many different services and programs available for people who register with the Alzheimer's Society. Outside of the Alzheimer's Society, there are some community-based organizations. My work is in the health equity space. So I support people from different cultural backgrounds. So folks can access Chinese Canadian centers, they can access South Asian centers where they have programs for older adults, maybe not specifically for dementia, but certainly offering that community socialization aspect, which is so vitally important. You can also go to various clinics. I know Baycrest here in Toronto, Baycrest, Sunnybrook, CAMH also has services and programs for people living with dementia. Behavioral Supports Ontario also has some supports for people living with dementia. So it's not it can be a very daunting minefield to navigate, I understand that. But certainly tapping into services that are available to you, alongside getting the early diagnosis, alongside connecting with healthcare professionals is your best bet to ensure better quality of life on the inroads into the journey. And there are many people to support you and to guide you through that process. You're not going to be alone on it. Trust me on that.
That's really great to hear, because just starting to navigate, trying to figure out who you're going to contact, there's so many steps involved. So I'm really glad to hear that the Alzheimer's Society of Ontario is a first start for people.
Yeah. They have a lot of support. We have a provincial and a national line to contact at any time, 24 hours. Mm-hmm. If you're having a moment of, I don't want to say crisis, but a moment of concern. We also have a really good program in some societies whereby if you have to go to the emergency room, sometimes one of our staff can accompany you there to help you navigate that minefield field in the hospitals as well. So depending on the society in your catchment area, there are a lot of services and supports for you and for your loved one.
So I'm just going to remind people, if you have a question, please feel free to raise your hand and one of the OBI staff can pass you a piece of paper and pen, because we'll be starting to take audience questions shortly. This next question that I have is for all of our panelists. So you've all touched briefly on sort of the role of stigma and language when it comes to brain health. So what kind of language do you think we should be using or not using when it comes to aging and brain health? I will open it up to anyone who wants to go first.
I'll kick us off. When I talk to folks from different communities and I say dementia or Alzheimer's, people recoil. I remember once I was contacting some folks out in another province, actually, and I contacted the head of a cultural community-based organization. I said, I want to talk to you about dementia. And she said, we don't have dementia in our community, and hung up the phone on me. And I thought, okay. And so, you know, in some languages, in some cultures, there isn't a word for dementia. There isn't a word for Alzheimer's. But certainly growing older, even though dementia is not a normal condition of aging, but in some cultures, growing older and that transition that may occur does have a name. And sometimes it's brain health, sometimes it's getting older, sometimes it's transitioning, sometimes it's returning back to our ancestors. And so I typically lead with how people want to talk about it. The content and the tenets of what it means to have dementia, what it means to have Alzheimer's, stay the same. How people want to engage with it, how they want to name it, I leave it up to them, and I meet people where they're at. I meet people how they want to feel comfortable in talking about it, and I find meeting them where they're at, we can get the conversation a little bit more forward around how to best support and care for them.
I'll just add, I would agree with everything Ngozi said, and it's challenging how you start those conversations. I know we have used brain health and those terms in a lot of different contexts, and especially when we're working with different communities, cultural groups that have really stigmatizing language. I'd say broadly, you know, some simple things are, we're always saying person with dementia or person living with dementia, not a demented person, not a demented patient. I think that when we talk about spouse, I know this is a little bit different, but we use language like care partner, caregiver, and not as positive terms. I think one thing that's really important that we recognize is often in relationships, especially if you're diagnosed early, the person with dementia is still providing care to the other spouse. So they really are a partner in care and not just someone who's receiving care. So it's not as simple as a caregiver and a care receiver. I would also say that it remains challenging, the best language, because even in English, you know, people don't always want to be, as I talked about, don't always want to be identified as a person with dementia. And I know we've talked about a lot of different terms. You know, is it memory problems? We recently had a meeting with where we had a person from Manitoulin Island, a community member, and they liked the word forgetfulness, the Anishinaabe communities there. There is someone who talked about acquired brain disorder. But I find that there's never any term that everyone agrees on. So it's really, as you said, use the term that they want when you're talking about a single person. And ideally, really, when we're talking to a person, they're just their name, their person, and their wife or their partner or their husband is their wife or their partner. And it's not, they don't need to be defined as caregiver or care partner, they're their spouse, right? And I think using that term to identify them as a person first is really valuable.
So yeah, language matters, and you don't have to complicate it. We can also refer to people as they are. Yeah.
You know what, you want to hear what we do as doctors sometimes in the clinic. So we'd say something like, let's say someone's coming in with stomach pain, right? And we know it as a certain way we call it in medicine, but we'd say, you know, do you have stomach, tummy, belly pain? And actually list out some of the synonyms for people and see what sticks, right? And for some people, it's their tummy. For some people, it's their belly. For some people, it's their stomach. Same kind of thing here. And I always love, as a general principle, person-first language. and person with forgetfulness,
Yeah.
or with memory problems, these sorts of things. And that helps us remember that actually 80% of health happens beyond doctors' offices and hospitals. It's the social determinants of health. It's income, food security, social connection. Do you have a caregiver that can help you navigate the system? Do you have those social safety nets to navigate your journey? All of these different things. And that's why, as we think about connecting everybody in Ontario to a family doctor, a big part of that is going to be building out teams, right? Because if you have teams of doctors leading those teams, but also pharmacists, nurses, social workers, link workers, systems navigators as well, memory clinics, all these different folks contributing to a person's care, that actually helps address that 80% of health that goes beyond the doctor's office or the hospital and those classic healthcare settings. That's why the person-first language, I think, is actually a nice health systems design concept as well, in addition to being important language that we use.
So what you've done, oh, go for it.
Sorry, can I make one addition? This
Go
is it's kind of going beyond language, but to a challenge for all of you and those online is I had a good friend who passed away a couple of years ago who was living with dementia. Some may know him, Roger Marple. And he was a fabulous advocate living with dementia. And one of his big things was don't make jokes about dementia. Right after he was first diagnosed, he was in line at the grocery store, feeling a little bit down, and someone was a little slow in front of him, and they made a joke. They were like, "Oh, I must have dementia." And for him, as a newly diagnosed, that was really impactful. He was almost in tears, and mentioned that too, because it was this customer as well as the checkout person who made this joke, and he said that we really shouldn't say that. It's really disrespectful. And they said, "Oh, it's just we're just playing around," and I think we've stopped doing that for mental health and for learning disabilities and for all these other conditions, but we need to stop making those jokes about dementia as well.
It's absolutely true, yeah. Because I think we sometimes forget who might be listening and what they might be living with. And we still sort of hear those phrases around things like, "Oh, I must be ADHD. Oh, I must have OCD."
Yeah.
But those are real conditions that people are living in, and we should be more mindful of our language. I'm going to go to something that Dominik was touching on because it's actually very timely. So today, March 19th, actually happens to be International Social Prescribing Day. So it's where thousands of local, national, and international organizations, including link workers, medical professionals, academics, and students, actually draw attention to this holistic method of care. So what is social prescribing? And are we actually seeing this happen now in Ontario and in Canada?
You want me to start off?
Yeah.
I bet all of us could talk in some way around social prescribing. I'll start with, who here has heard about social prescribing? Raise your hand. Yeah, a few. You know what? You could think of it as a marketing word that captures everything that contributes to your health beyond the hospital and the doctor's office. That's what social prescribing is. So let's say someone can't afford, let's say I have a patient in front of me. I'm their family doctor, and they can't afford their medications. A referral for medication coverage, that's a social prescription, right? Because it happens beyond the doctor's office, the hospital, and it influences their health. And also something like, let's say someone has diabetes, and they have trouble finding safe, nutritious, affordable food. A good food box referral, that's a social prescription, right? A program like the visiting program from the Alzheimer Society to hospitals or to a museum or community group or support group, that's also a social prescription. All these are social prescriptions, and the importance of this is that things like social isolation is like smoking 15 cigarettes a day in terms of health impact. Right? So it's no surprise that the things that we call social determinants of health, or what we talk about in social prescribing, have such a big impact on health, and why it's so important to build them in to the healthcare system so that family doctors, when we recognize them, we can make those appropriate referrals and we can work in a team to address them with people like social workers, link workers, systems navigators, organizations like the Alzheimer's Society, but also caregiver supports, the Ontario Caregiver Organization, another great example of a social prescription, and so on. This has been transformative in terms of how we think about healthcare, is with that social prescribing lens.
So not to steal your move, but now I'm curious, has anyone received a social prescription in the last few years? Would you be interested in receiving a social prescription from your family doctor?
Let's say you can't afford your medications. You need to go to the emergency, but you have no one to go with you. Let's say you have yourself or you have a family member who you want to contribute to your community, but you don't know where to start. Right? You want to maybe have some volunteer or connection opportunities. All those are examples of social prescriptions.
And Ngozi, are you beginning to see more social prescription work happening and intersecting with your work?
I am. I think it's wonderful because it's the recognition of the social determinants of health. It's the recognition that there are different factors that impact our health status and our dementia risk as well. And we do know that older adults tend to have higher rates of loneliness for a variety of factors. So having that social prescription of saying, get out and socialize, get out and eat healthy, go for a walk, take some time for yourself, those sorts of things is really important. We have seen people coming in more wanting to socialize with us, wanting to meet other people, wanting to have those community connections. So we do see that. And in my work, I do see a lot more community-based organizations trying to have more areas and opportunities for gathering, right? So fairs and events and those sorts of things. Not in a formal, socially prescriptive sort of way, but certainly getting people together is really, really important. And that's fundamental to our health, it's fundamental to our well-being and our aging process as well. So seeing the medical complex really take it more formally is absolutely wonderful, and looking forward to seeing what's going to happen with it.
Laura, I'm going to come to you next. We've gotten a few questions around Alzheimer's disease. People are curious about what is the average onset of Alzheimer's diagnosis, and what are some steps that people can take to slow down progression, or what are some risk factors?
Yeah, that is a great question. I don't know, I should know the average age. Ngozi, do you know the average age?
Yeah, well,
There you go.
So there's two kinds. There's sort of early onset Alzheimer's, early onset dementia, let me say, and then sort of the more formal onset of dementia, and that typically happens around 65, and I say around 65 as the age of onset we'll begin to see it, but we can see early onset as well. You can see it in your 50s, in your 40s, and even younger, depending on certain factors, but typically 65 and onwards, but mostly, like we see a lot more over 80, 85 as well.
And I would say that the 65 is our dividing line between young onset and older onset. I'd say even within those, so it's the younger you get, the less common it is, but there's certainly people who are diagnosed in their 30s. My aunt, this is how I got into this work, was diagnosed at 46. When her children were quite young, and so that was my motivation. The younger you get, the less common it is, but it happens. And then in the late onset, yes, that 65 is the starting point, but then it doubles, your risk doubles every 5 years. So it's a lot more common at 85. The estimates are not great. It's anywhere from 20% to 40 or 50% of people 85 will at least have some sort of cognitive impairment. I don't know what the average age is probably in the 70s somewhere, but it does increase with age.
And risk factors.
Oh, risk factors. Forgot the second half of the question. So the great news is that we're understanding more and more about risk factors. Many of the things that can reduce your risk of dementia are also things that will reduce your risk of heart disease and of cancer and of numerous different conditions. So there's worldwide estimates for what accounts for the most dementia cases in terms of modifiable risk factors, and there's also Canadian estimates. So both of those kind of around 45% of dementia cases are preventable because of risk factors. In Canada, because of our socioeconomic, our habits, physical inactivity accounts for about 10% of cases. It's far less on the worldwide level because people are more active on average than in Canada. Hearing loss is a new one on the block that's more specific to dementia. So get your hearing checked. It's also very common, right? A lot of people experience hearing loss in later life. Get it checked, get it treated. We don't fully understand in terms of the interventions how much it helps and reduce it, but that's worthwhile getting on all of the vascular risk factors, hypertension, diabetes, obesity. Those are also risk factors. So get those treated, try to look after them with healthy eating and physical activity. Other ones that we've talked about here, social isolation is also a factor for dementia. So get out, socialize, be connected with your community and with your family. I'm trying to think of other ones. Sleep disturbances are risk factors, so do get that checked if you're having trouble sleeping. I don't know. Probably lots of the women in the room would put their hand up, and I'm sure the men as well, but get that checked and looked after as best as you can.
I'm sure genetics.
Yes, there's also, other genetics for sure. I haven't even talked about the non-modifiable risk factors. Age, I did. More females have dementia than men, and more females are care partners, so both. There are some genetics. So there's some genetics of early onset that are actually almost deterministic, right? If you have it, it will carry it. For most of us, that's not the case. So there is a genetic risk factor called ApoE, and if you have E4 variant, you're at higher risk of dementia. But that's really, it increases your risk. It doesn't determine whether you get it. And the good news is, even if you're a carrier of ApoE4, then these preventative strategies like physical activity and social engagement and potentially learning and cognitive, those are still protective against getting dementia. So even if you're at risk, you can take action against it.
So I think this is a great moment to step away from the audience questions and just ask a bit of a broader question. So people are here today to learn about elder brain health, but when they go home, where should they turn to for trusted information? Because there's a lot of information out there, and where can people find reliable information, and where can they find the facts? Maybe I'll start with Ngozi.
Yeah, I'm going to plug Research Institute of Aging, where Laura works as well, the Alzheimer Society of Ontario and of Canada. We have a multitude of resources and information accessible for the general public in multiple languages as well. Doctors' offices as well, healthcare institutions are also very important in getting that information. I want to say PHAC, Public Health Agency of Canada, they also have information as well. Should I be listing off all of them?
No, we can turn to someone else. How about you, Dominik?
You know what, I recently did an interview on people using ChatGPT and AI for medical advice. So, maybe we're not there yet. But maybe someday, and I would say when in doubt, because there's so much misinformation out there.
Yeah.
There's so much misinformation. When in doubt, talk to your doctor, talk to your health professional, go to these trusted sources, right? And when I think about that information, it's not just information about the medical stuff, it's also how do you navigate the healthcare system? How do you navigate the healthcare system? And that's where groups like the Alzheimer Society, groups like the Ontario Caregiver Organization can play such a big role. I think of the Ontario Caregiver Organization often because so many of us are actually caregivers as well. In addition to our own personal health, we're also caring for a family member or a loved one who has their own health journey, right? And the Ontario Caregiver Organization has a phenomenal helpline in so many different languages that can help people navigate the healthcare system and navigate through some of the misinformation that's out there and how they actually get care for themselves and then for their loved one. So that's what I think of. Doctors, probably not ChatGPT yet, and then trusted sources, like some of the ones you're seeing here today.
Laura, do you have any recommendations?
Yeah, I'd echo many of the ones that were already mentioned. Certainly the Alzheimer's Society. I appreciate that you mentioned the Schlegel UW Research Institute for Aging. as well as family doctors, the only caution I'd say is sometimes some family doctors are less encouraging about being able to manage your brain health. And that's not the majority of them. The majority of them will know some of this about the strategies. But certainly people have sometimes gotten a diagnosis, a cognitive diagnosis, and said, go home, there's nothing you can do. So don't take that as your answer if you're told that. I think go to these resources, whether it is the Ontario Brain Institute, for example, whether it's the Alzheimer's Society, the RAA, the Public Health Agency is sponsoring more around dementia as well, both prevention as well as after and supports, so that you get that information. Because the challenge is, physicians have to know a lot about everything, and the prevention is often a smaller component of the education, especially when it's about individual content. So that's challenging, but even if the Alzheimer's Society, for example, doesn't have the answer, often they know about other supports you can get to. So it's a great center to start with.
Can I yes and that?
Yeah.
So in an era where people are living longer, with more medical conditions going on, with more health needs, with more complexity, chronicity, all these different things, this is why building out teams in primary care is so important, right? We know our family doctors are feeling stretched. At the same time, we know everybody deserves a family doctor, right? And we know that better care happens when we plug in teams to those family practices, including folks that would be so well versed in the prevention and good aging, and folks like link workers, social workers, aging specialists, all these different sorts of people plugged into primary care to support our health system workforce.
Yes.
And can I just say one thing? I'm so sorry. In this room, we all have family doctors, but for those of you who know folks who don't have family doctors and thinking, how do I get a care team around me? They may have to make one. They may have to go to their pharmacist and say, hey, can you help me with this and help provide that care until I can find a family doctor. Essentially, it's a coordinated effort when the diagnosis is there. It becomes a coordinated effort with folks in your life, in your network that can support you in the best way that you need.
So that leads in perfectly to my next question, which is, a few audience members have asked, well, how do I find a family doctor if I don't have one? And is a registered nurse good enough? Point it to you, Dominik.
You know what? Every health professional has a role in the healthcare team. The evidence that we have for you living longer, for you getting cancer screening done on time, for you avoiding emergency rooms in hospitals, is connection to a family doctor. Full stop. It's that relationship with your family doctor. But the way to make that happen is to build out teams of family docs, pharmacists, social workers, nurses, nurse practitioners, all sorts of health professionals working together in your care. That's how we connect everybody to a family practice. And that means we're sharing in the work, we're doing the care. And that's actually the vision that's coming out with the group led by Dr. Jane Philpott, former federal Minister of Health in Ontario. Another question, have you heard of this announcement, the Primary Care Action Team, Dr. Jane Philpott? Yeah, a lot of you. Yeah, so this government is doing something I think is very bold, and they're saying to family doctor and former federal Minister of Health to help lead a vision where we connect everybody to a family doctor and build out teams to do that. And their goal is within 4 years, a connection for everybody to a family practice. And that'll be transformative. And that's how we use all health professionals to their most full scope. It's not, the solo pharmacy, the solo doctor's office, this is the solo nurse working alone. It's all of us working together and building out teamwork and building out probably health hubs, family practices. That's how we get to this vision of a family doctor for everybody in Ontario.
So I'm going to push you just a little. What about people right now who don't have a family doctor? What can they do?
Yeah, so that's on the policy side. If you don't have a family doctor right now, that's the challenge, right? And we saw the headlines in the news a few weeks ago in Walkerton, where over 1,000 people lined up as early as 2:30 in the morning in the middle of a snowstorm just for a chance to find a family doctor. That's the reality we're living in Ontario. right? So this challenge couldn't be more urgent, but for people looking for a family doctor right now, I encourage people to ask around, ask family, friends, ask doctors that your friends or relatives are connected to if they're taking patients or if they know of new doctors coming into the community. Look on Google Maps, visit the offices, get to know the receptionists as well. They're oftentimes the holders of the wait lists. And what I'm looking forward to is working with the government and getting to that vision of a family doctor for everybody, where people don't have to play this game of trying to find and trying to desperately look for a family doctor and line up in the thousands just to try to find one.
Can I just?
Of course.
And as a stopgap, for those on the call and online saying, well, I don't have a family doctor right now, nurse practitioner clinics are available across the province that people can utilize. I know in the context of dementia, I know the wait lists are very, very long to get a diagnosis. Sometimes you're waiting 9 months, 18 months. For the Alzheimer's Society, some societies do offer cognitive assessments. It's not a diagnosis per se, but it's a starting point. And usually what happens is after the assessments, it would get sent to a family doctor to give you more of that formalized healthcare. But in the meantime, getting that assessment can help put you on the path for certain medications if need be, or certain therapies and treatments that can be made available to you through the Alzheimer's Society and other agencies and organizations as well. So there are some stopgaps while we're waiting for the family doctors to sort of become more plentiful. So looking into nurse practitioner clinics that are available, looking into, unfortunately, walk-in clinics. Not anyone on the call, I love walk-in clinics, but it's, and also contacting local Alzheimer's Society in the context of getting an assessment and some supports around any cognitive issues.
Yeah, I feel you in the walk-in clinic because it's not someone you see regularly, and you really want someone who knows you and who understands your health instead of having to sort of start off from the start with every person you meet. We've been talking a lot about people who might be living with cognitive impairment, but what about their care partners? So we've actually gotten a question, which I'm going to direct to you, Ngozi, is that what are some supports that are available for care partners?
Well, I've been a care partner for 17 years, and I will honestly tell you, being a care partner to someone with dementia, I will validate everyone's feelings and emotions. It can be very hard. It can be very challenging. It can consume a lot of your time and your energy, and it can be sometimes a very lonely, isolating journey. I will be very clear and honest about that. The supports that are available, thankfully, there are supports. There are support groups. Going to support groups can be a very refreshing, rejuvenating, validating experience. It can be very hard to schedule time to go to a support group. Actually, there are some respite services as well offered again through the Alzheimer's Society around the province where you can, your loved one with dementia can go for either for the full day or a few hours, and that offers the care partner some methods of respite for a few hours or up to the full day. There's also services where you can contact through, I know it as CCAC, may not be a CCAC anymore, where you can get PSWs to come into the home. There are some subsidized programs for up to, I think, 20 hours a week, where you can have a PSW come in to help with some daily living activities to offer you some respite in that way. Victoria Order of Nurses can also offer some supports and programs for folks who need that support in home as well. What else is there? There is one more I'm thinking of. Counseling support is also available through the Alzheimer's Society across the province and the country writ large, which can be very helpful to sort of talk through any feelings that you may have. Behavior Supports Ontario can also help support folks at home, any behavioral changes or challenges that might be happening. There are some supports to help the care partner sort of understand and navigate better as to what to do. I spoke with that time my father's geriatrician and family doctor who gave us some insights on what to look for. Getting knowledge as care partners is really important. Understanding what's happening with your loved one, understanding what's happening with yourself as you're caring for your loved one gives you that power to say, I can handle this. I know what to expect and I know what's going to happen next. And that itself can be a protective factor for yourself against stress, which can be a determining factor for dementia as well. I hope that's helpful for folks.
I'd just like to, I concur with everything Ngozi said about the resources, and that can be a challenging an isolating experience sometimes. And I'd just like to add a couple things to that. And one is broadly, if you talk to your friends and family about dementia, with a person with dementia and care partner, it means they're more likely to be able to support you. If you keep it silent, then you're reliant on yourself. I remember when my aunt was diagnosed, they didn't tell their neighbors that she had dementia. And they could have been a support to her, right? If he had to run out and she couldn't be at home alone at some points in her journey, they could have come over. But because it wasn't shared, because of that stigma, they weren't able to offer support. And I think in that way, being able to talk about it is really important. And asking support from family members, because there's usually one primary care partner, and there may be a caring team, but asking and being open and not feeling like you have to hold all the burden and all the stress is really important. I think that there are some programs now that we're trying to encourage that support the health of the person with dementia and the care partner. So we've seen trials and interventions where it's really about the person living with dementia. We're trying to approach that side by side, because when we run an exercise program for people with dementia and their care partners, where they're both independent participants. When we had people coming in and doing their health screening going into it, the care partners were more likely to have undetected health issues than the people with dementia, because they weren't looking after themselves. So there are some community programs, Minds in Motion, you're both exercising. We have a program that we're just implementing and rolling out across Canada called the Delight Program that has shared learning about a number of topics in exercise, but it's truly meant to improve the health and well-being, mental well-being, physical well-being of the care partners as well. So it's not all there yet, but they're emerging as well. So I think thinking about your health is really important.
Can I just say as well, for folks on the call and folks in the audience who come from different cultural backgrounds, where talking to family and friends might not be readily available or easy to do. And I feel that because I went through that myself with my family. My extended family, they weren't going to hear about dementia. We don't have it in our language. It's not in our culture. Dad's just old. You kids are being too sensitive. You kids are being too Canadian. And that's a real thing for many different cultures. You're laughing. I can see you in the corner. I know it's true. So what I would encourage people to do, as Laura said, find someone in your network. It can be someone at the church, the mosque, the synagogue, wherever it is. Usually in faith-based organizations, the leaders, the elders, they know. They've been talking to people. Yeah. They see it, right? In my culture, I went to a food, what do you call the place you eat? Restaurants. I went to a restaurant. Sorry, I'm very tired myself. Here we go. I went to a restaurant, and it was one of the owners. The owners who had been around for a long time. They were talking to me about their wife, about what their wife was going through. So you can find people in the most unassuming places who have been on this journey, who know what you're going through, and who can talk with you and support you. It may not actually be your sibling, your cousin, your auntie. It may not be them. It may be your church leader, your faith leader. It may be the person down the road. But find people. I talk very openly about it, and I still get a lot of heat from my family for putting our business in the street. I am, because dementia does not discriminate. Dementia does not discriminate, and we deserve to have support, and we deserve to be heard. So find those people, recognizing that it's not always easy, but it can happen.
Yeah, beautifully said. Yeah.
Speaking about, go for it.
I gotta say, a one-stop shop for people. If there's this patchwork system of supports for caregivers. We're talking about supports for caregivers. A lot of pilot projects that are good for 6 months and then kind of fizzle away, waiting for sustainable funding. When in doubt, what I recommend to people is call 211. 211 is actually the one-stop resource in, I think, over 100 different languages. They can call you back, do some of the navigation with you. 211 is a phenomenal resource for caregivers, or if you're thinking of, look, I have this challenge, which group, which community group can I lean on for this? Where can I contribute? The other one is the Ontario Caregiver Organization, obviously for similar types of reasons, but really focused in on supporting caregivers in a wide variety across all communities, right, in Ontario. So when in doubt, 211, Ontario Caregiver Organization. Those are my recommendations when I'm speaking with patients. 24/7, exactly.
Staying on the topic of care partners, we've got a question about, what can a care partner do if someone living with dementia or cognitive impairment isn't following through on any of the social prescriptions or the recommendations they're receiving from healthcare professionals? How do they navigate this? And what can they do with sort of dealing with not only the frustration, but also the fear or worry that you have? I will maybe start with Ngozi.
I don't have to start though,
Oh,
but
sure.
I can talk more.
It's okay.
So you're talking about sort of I call it the resistance to the dementia journey. And that is so real and so heartbreaking and so frustrating, to be quite frank. And I will say, when it comes to being on the dementia journey, there are approaches that can work, that have been tested in evidence-based, that can work, but everybody with dementia is everybody with dementia. So some approaches may work on some folks, but not on other folks. I will say though, when someone is resistant, I tend to lean into that resistance. For example, my father had a difficult time speaking. He had a difficult time talking with us, and he would repeat things and repeat things and repeat things. And my brothers would be like, "Dad, stop repeating it." And I said, just lean into it. Just hear him, acknowledge him, validate him. And when we did that, he stopped repeating things, right? So it's meeting folks who live with dementia where they're at. And so if they're not following the social prescriptions, unfortunately, where can you step in to fill in those gaps? So if it's like, oh, I can go outside without my jacket, I'm fine, it's not that cold, I can go outside, and you're thinking, oh my God, what am I supposed to do? They're gonna freeze. Well, what can you do? Maybe provide a sweater, provide a jacket close at hand where you can. We used to live in a condo building, my father and I. We had the office manager, the condo manager, and the security folks. They all knew my dad had dementia. So whenever he left the house with a jacket, they would be like, "Oh, sir, you forgot your jacket. Oh, thank you." So we got very ingenuitive around that sort of thing. When you feel like, I can't do it, get some support around that. The frustration you feel is real. The need for validation is also real, and it's not their fault, and it's not your fault either. This is the disease talking, this is the disease manifesting. So finding ways to acknowledge and validate your feelings and acknowledge where they're at and try to meet them where they're at, where you can. Sometimes it is going to be difficult. Sometimes you will have to employ other techniques and some help. There's a good woman, is it Tippy Snow? Tippa Snow, for those of you who might know, Tippa Snow. If you Google her, she's a dementia expert, and she talks about these behavioral sort of issues that happen and how you can support yourself and your loved one with dementia. Again, Behavioral Supports Ontario also has some good techniques and supportive ways in this sort of, I call it, transitional period.
And then speaking of Google and technology, Laura, I'm going to come to you. What are some ways that technology can help support people who are living with cognitive impairment? What are you seeing in the research?
There's the research and lots of creativity, but there's also the way, so I'll start first with the way I see it being done on the ground. Because there's a lot of innovation around technologies that people are getting, whether it's to track people, to prompt people with their everyday life. But some of the interesting things that people are using is they're using Google Home to set up prompts for them. They're using these technologies that are made so they're accessible to remind them. They're using whether it's their cell phone or an Apple Watch to track your location. So that means if someone really likes walking on their own, you can do it more safely because you know where they are. You don't need the high-tech device anymore. That's the great thing, is that we have these location trackers in our pockets or on our wrists all this time, so that those are ways that we can be helpful. I think in terms of technology, there's everywhere from ways to be active at home. We were just talking about different exer games and cognitive assessments. People are exploring cognitive assessments at home. People are exploring how they can track safety at home. Do you leave the burners on versus not? Not all of those are immediately ready for implementation, but really there's a lot of work going on in how can we keep people independent in the community for as long as possible.
And Dominik, how are you seeing a shift of use of technology in seniors, and what are some of the barriers that still exist?
You know what, there's The reality is, that I think of my grandma, for example. There's no way she's logging on to, ChatGPT or some of the tools that some of the startups are releasing, and so I think it's making it realistic. And then also, there is a lens on build it for the caregivers, right? So even if the consumer of the product won't use that technology, maybe that's okay. Maybe the customer is the caregiver actually, and it's caregiver supports in terms of technology, just like using AirTags and these sorts of things to make sure family members are safe. That's what I'm seeing. Flip side of technology is that there's always a risk that we over technology healthcare and people's health journey and people's lives, right? So the flip side of it is that we can't let go of the relationship that people have to their caregivers, to their community organizations, to volunteer groups, their family doctor. Those all rely on relationship, human connection as well. And that's the thing that we really need to keep sacred, even in this kind of technology era that's coming up.
Can I just add one thing to that? This is, again, I don't know if it's an innovation, but I think I always think of one of the only positive outcomes of the pandemic was this shift in the availability of virtual programming. So for people who couldn't drive in, whether it's because of location or because of traffic in Toronto, now have access to programs. And I don't think that virtual programming for people with mild cognitive impairment or dementia would have happened for 10 years, if not for the pandemic. And now nearly every Alzheimer's society will have some sort of programming virtually. And I think it is ideal to be in person, absolutely. But for people who aren't going to access that service otherwise, it does give an opportunity to connect online, to access programming, to connect with others, to share their feelings, whether it's a support group or an exercise group or any of these different, even telehealth is an example of that, right? That has been a huge shift in terms of availability of services to a greater portion of our population. And I think we also saw a huge uptake of seniors using tech. And part of that is, the cohorts, right? The people who are 65 now have used computers throughout all of their life. Like, it's not the same as it was 20 years ago. And, my parents are about 80 now. They both have smartphones. And that's not the case of everyone, but it's becoming more and more common. I'm sure most of you in the room have some access to technology, and that's probably how you found out about this. So you're biased, but that's that ability to expand our reach for programming through virtual technology, I think, is really a game changer.
I think that's exactly right. So we just came back from a trip to all of the small rural northern communities between Sudbury and the Sioux. And if you've been there, if anyone's from there, you know that healthcare and supports are just a completely different planet than what we have here in the GTA and in urban centers, and even in northern urban centers. Rural north, completely different. And that's where tech, doing things over Zoom, these sorts of things, that's a lifeline actually for communities there, and something that, the human connection is important, and at the same time, it's actually okay to bridge gaps like that, because otherwise people are traveling hours just to get some form of care, just to see their doc, just to go to their organization or volunteer group. And if it's the winter, or there's a storm or a highway closure, you're not getting there until a few days later. So that's the reality that we're dealing with in rural north, and that's why actually it is important to continue building on what we've done in the pandemic to expand those programs.
Absolutely.
One of the challenges to technology use can, of course, be finances. And that's true not only for technology, but for a lot of the programs or treatments that may be offered. So one of the questions we've gotten is, what is available to people for free, and where can we find these services?
That is a huge challenge. I think, when we talk about social prescribing, I know I've talked with a number of people about this. The prescribing is one thing, but social prescribing with funding is a whole nother game changer, because access, even transportation to places, that comes with a cost. There are places where things are free. A lot of Alzheimer's Society programs and services are free. Some community centers and senior services run by the municipality, by the city, are at least low cost and may have reduced funding or free funding for people who don't have the money for services. I know we work a lot with the YMCA as a group, and they certainly have reduced costs and support for people, whether it's people who have financial challenges, as well as new immigrants and refugees who have also language and cultural issues. So there are organizations that are improving that. I would let Dominik talk about the healthcare funding and Ngozi, but there are some of those out there for supports.
There's a welcome policy by the city as well.
There's a-
Welcome policy.
A welcome policy?
Yeah, by city.
Yeah, excellent.
I don't know if anyone else wants to add about accessible resources to recommend.
Do you want to add?
2 thoughts. One, healthcare, you already pay for it in your taxes, right? So the average Canadian family, I think the stat is that you pay $10,000 per year for healthcare. If you can't get a family doctor, if a relative can't get access to the healthcare system, if you see an emergency department near you that's closed, or in a community that's closed, if you can't get access, talk to your elected official, right? You already pay for a strong Canadian healthcare system. That's number one. Number two, social prescribing. I think sometimes there's this assumption that social prescriptions have to be kind of deficiency-based, right? Where you're doing a social prescription because someone's in need of something, in terms of food security, income, these sorts of things. Some of the best social prescriptions that I've seen have been not just free, but based on the person's strengths. Mm-hmm. And I think of examples where the person identified that they were socially isolated. They identified an opportunity to volunteer with something that they're passionate about. I think of one person I was caring for a few months ago that their spouse had just passed away. They felt isolated. They knew it was taking a toll on their health, and they started volunteering at their hospital in the gift shop. What a beautiful social prescription that is. And not just free, but it's using this person's strength to give back to the community, and also good for them as a human being and for their own health.
Mm-hmm. It's interesting because one of the questions we had gotten was, is a social prescription just a written document or just my doctor telling me to join a seniors group? But it sounds like it can be a lot more than that.
Yeah, and I'd say that the most powerful social prescriptions are ones that people identify themselves or create together with their doc. And oftentimes it's just prompting. What does your life look like? What are some of the things where you could see making a difference to your health? And having some shared ideas around what that might look like, including volunteerism.
Can I just say as well, when it comes to trying to find funding, connecting with your local Ontario health team and the Home and Community Care Access Center, CCAC, they can assign you a caseworker, as it were, and they can help find subsidized programs, subsidized pharmacare supports for folks on limited income or low income. So those options are also available to you as well.
Laura, one of the questions we've gotten is that someone is curious to know, how do I know if I'm at risk for dementia genetically? Is there a test for this?
There is a test for it, but it's not broadly done. If you have a family history of young onset, there is sometimes availability of testing. But because there's not an obvious change in treatment or change in prevention strategy, it's not done broadly. So when you're probably more likely to get genetic testing done in research than you would in the clinic. So yes, it's possible. There's not a health system that's generally doing that, at least not unless you're at very high risk for dementia.
So it sounds like something people should talk to their family doctor about?
What I would say is there's not probably any reason for most people to get genetically tested. The strategies that you would use to reduce your risk of dementia would be the same regardless of the outcome. It just means that you have a higher risk or a higher risk of experiencing it a few years earlier. But it's not, a yes, no, you're going to get it. And so I don't think it's something, it seems curious, but I don't think it's something that most people would pursue.
And Ngozi, a very specific question for you. So, are the dementia clinics at places like Baycrest and CAMH, are they a good entry point for folks who do not have family doctors, or is it starting off with more general resources that you had mentioned in the beginning at better?
Yeah, Baycrest, CAMH, Sunnybrook, anywhere that does cognitive assessment could be a good entry point into I call it the dementia complex, as it were, where you can't get a family doctor or nurse practitioner to offer that support. MINT clinics, memory clinics are also very important in the dementia complex as we have it here in Ontario and across Canada, because getting that assessment, again, it's the first step onto the pathway. It's sort of the gate, not the gatekeeper, but the gate into getting more supports, getting more information. The Alzheimer Society can offer that as well. So I'm not limiting it to Sunnybrook and Baycrest, but there are a host of other institutions that can offer that early assessment. I don't want to say diagnosis, but that early assessment.
All right, so it's 7:40. We've got about 10 or so minutes left to go with questions. I'm going to step away from the audience questions for a second. I'm going to start with you, Dominik, and then run down, so I'm giving everyone a warning. We're talking about elder brain health today, but what are some of the common sort of myths that keep persisting or misinformation on this topic? Let's start with you. What's the one that keeps coming back for you?
You know what? I don't know how we get rid of the myth that kind of episodic walk-in, emerge type care is good enough for anyone of any age, let alone older adults, right? There's so much risk if you don't have a connection point to the healthcare system that's consistent. We know that you end up in emergency departments more often, you end up in hospital more often, you end up missing cancer screening, prevention care, and end up costing the healthcare system more money. I think we just need to shake that myth that, oh, if I go to the walk-in clinic, I'll be okay. If I go to I'll use the emerge as my front door to the healthcare system, because that's not an acceptable shape for the healthcare system, and then it's also not acceptable that people have only that as their entryway into healthcare. So I would say it actually does matter that you have a consistent access point to a family practice or primary care team. That's what I would share for this one.
Laura, what's a myth that keeps coming back for elder brain health?
Yeah, I think the thing I hear from people often is this idea that there's nothing you can do once you're experiencing cognitive impairment. And we still hear people who go, and again, not to discourage family physicians, but people who get a diagnosis and are told to just go home and plan for the end. And maybe you have 3 to 5 years. And we know there's things that can improve your ability to be independent for longer, and we're still developing it. But that being active, by getting out, by getting support, you're going to live better with the condition. And so please don't listen when they tell you to go home and don't go out anymore. Go, speak, share your diagnosis, because then people can support you. And this is a second one. This is less of a myth, but I think is just how we think about it, is often we treat prevention and care or management of dementia as two separate mandates. And we do this all the time in research. We have prevention, and then we have care. And it's not. There's not some magical line where suddenly you have dementia and nothing that worked 2 days ago will happen 2 days from now. So I would challenge people to think about this together. You're just looking after your brain health, from the time you're born, right, through to the point if you have dementia and you're making the best of it.
Rosie, what are some myths that you keep encountering?
Oh, God, many. I will say, to Laura, just picking up on Laura's point, that dementia is not something that you worry about, as you get older. It's something that you should be thinking about as you're younger. I know many of us in the room, myself especially, when you're in your 20s, you're out and about, just carrying on, and you're not really thinking about what's going to be happening later on for you. But taking care of your brain health means taking care of yourself now. It means going to bed early. It means, doing the things that are going to support healthy living, as well as healthy aging, right? The second myth is always the stigma around dementia. Always, always, always that bloody stigma. And all the ways in which dementia is mischaracterized and I want to say, engaged with. And understanding that dementia doesn't have to be something that is, taboo and oh no, but being able to engage with the conversation around dementia, the conversation around Alzheimer's, the conversation around brain health. And I know the risk for some people, what that means, but if it means that you have a better chance of having a better quality of life as you age, it's worth it. So debunking the stigma around dementia, what dementia is and is not, getting that information from healthcare professionals, from research, from institutions and organizations really help, not just to drive the conversation forward, but it just helps you and your loved ones being able to manage anything that might be happening as you get older, or even now.
So in terms of myth busting, we can do more to create public awareness and sort of empower people with knowledge. One step is to attend events like this, but one of the questions we actually got was, what has been done to increase public awareness and what can we do more of? Maybe I'll start with you, Laura.
Yeah, absolutely. I mean, the good thing is we finally have a national dementia strategy. So it's about 5 years old, and so we do have people like the Public Health Agency, as well as other people they've funded, whether it's the Alzheimer's Society or different community groups that are starting to spread more awareness. I would say in terms of impacting stigma, because we can do education, and that's pretty easy to do and get out there. But in terms of impacting stigma, the most effective strategies have been ones where people actually engage with people living with dementia. Because it changes your view from that one family member or the person that you've seen in late stages, because those are the observable, those are the keen memories, to recognizing that dementia is this whole journey from people who are still very active, who are, whether they're singing on stage, and I'm going to forget, what's the singer that that Lady Gaga sang with?
Tony Bennett?
Tony Bennett,
Yeah.
singing with
He has
dementia.
dementia?
Yes.
I didn't know that.
Yeah.
Look at that. I learned something.
Yeah, and Great Big Sea, or a Canadian one. But so it's singing choirs, it's talking to people, not being afraid, because that's really what changes the stigma of dementia. And so I think the more opportunities we can create kind of inclusive environments that include, yes, people of physical activity and physical impairment and people with sensory impairment, but also people with cognitive impairment, it allows us to understand each other and treat each other with patience and paying attention to what people really need, and it gives us a much deeper understanding.
And Ngozi, what would you do to change public awareness or improve it?
I do talks. I talk. I never shut up. I talk about dementia. I talk about dementia all the time to normalize the conversation, to get people to be curious and inquisitive, and hopefully taking it. Thinking about it in a different way. Absolutely, people living with dementia, they're not, put out to pasture. You get the diagnosis, oh no, that's it. People living with dementia doing wonderful, amazing things around this country, around the world. Also talking to the youth, getting the young people involved, having them learn. And you have great projects you're doing, as well as Alzheimer's Society of Ontario, getting the youth talking about dementia. It's not just, oh, my great-grandma or my grandma, but getting them thinking about brain health, getting them thinking about healthcare, getting them thinking about aging and living well. I have a friend, a quick story, I have a friend of mine, she is an insurance underwriter, and she said she got a call one day from a man who had said he had gotten a diagnosis of dementia, early stage dementia, and early onset, and he didn't know what to do. And because I had been speaking to her about it all the time and just in passing, she said, I'm going to help him. And so that level of awareness, where it permeates through society in ways you may not even be aware of, just having conversations about it. We do a thing called dementia-friendly communities at the Alzheimer's Society. So we go to different organizations, libraries, banks, Tim Hortons, and we teach their staff about dementia signs and symptoms, how to respond to clients who may be living with dementia who come into your establishment. That's another way that we can disseminate understandings of dementia to the public more broadly. But I always say, I mean, for me, talk and just normalize.
I just want to quickly add on to the youth, because it is an area that I'm really passionate about. I have 2 kids that are 10 and 11. And I talked about this with a few audience members earlier, but she wants to, she'll say, oh, can I come with you? She wanted to come tonight. And I said, no, you need to go to school. She's like, oh, can I please come? But she came with a community workshop that was around dementia-friendly communities. I said, you can come as long as you contribute. And so she engaged, she shared ideas. And then a week later in the car, in our carpool to swimming, then she's talking to her friend about dementia and advocating. And so it made me realize how important youth are. Because I think they have a greater recognition of the diversity, neurodiversity, gender diversity, all sorts of diversity, right? They have a different understanding of diversity than we had at the same age. And so when they think about dementia, they just think about it as part of that diversity. And so we've worked, and I actually have a member of that team, Bill Highbine, in the audience. We've worked recently on developing a toolkit for youth to understand dementia, not just for kids who have family members, but for all youth. And we've developed a Dementia Youth Alliance that really it's about talking and sharing knowledge around dementia, because I think that's the long-term game, is changing their perspectives when they're young before they've developed stigma.
I love the idea that your child is just an ambassador influencing all the children in the neighborhood.
That's right.
Dominik, what would you do differently to improve or increase public health awareness?
Yeah, you heard a lot of wisdom on the public perception and advocacy in dementia. These decisions, guess where they get made, right? Healthcare is a provincial responsibility. These decisions on our healthcare system, on memory care, the funding decisions, what gets funded, what doesn't, those decisions get made by the people working at Queen's Park. And some of the most powerful advocacy I've seen has been people sharing their stories, people sharing their caregiver journeys to their elected officials. And that's my invitation to anybody watching this. There's one thing that you want to do to get to a better healthcare system, to get to a better memory care system. Share your story with your elected official. You can look them up by your postal code, share your story. They'll meet with you because you're a local constituent. Tell them what it's like to be living with a memory issue, or be a caregiver, or be trying to navigate the healthcare system where it is right now. We have a new government that just formed, new ministers, new mandates. They need to be hearing from you. And that's how we get our system back on track.
Can I just jump off at that point? So the Alzheimer Society of Ontario, we have something called the Advocacy College. It's a free online college where you can join up and register, and it teaches you how to be an advocate to your elected officials. And why is that important? Ontario does not have a provincial dementia strategy. We used to, and it ran out in 2019, 2020 during COVID, and our government was much more preoccupied with COVID, rightfully so. Now we have a new government, and they are looking at developing a provincial dementia strategy. So hearing from constituents, hearing from the people of Ontario, saying how dementia impacts them, what they would like to see within a broader dementia strategy, we're in a really, really good time to do that. So the Dementia Advocacy College with the Alzheimer Society of Ontario is available to folks, or just contacting your MPPs, your MP, and saying, hey, we need to have a conversation.
And just a note on advocacy, advocacy is often a big word, but it's just having a conversation. And there's so many ways to have that conversation. You can send an email, you can call them, you can drop by their office, but maybe make sure they're there. It doesn't have to be it can be rallying, it can be protest, but it can also just be a conversation. So lots to advocate about that we've talked about tonight. We're now coming to our last question of the night. I'm going to start off on this end, and we're going to work our way down. So to each of our panelists, what would you like the audience to take away from tonight's talk on elder brain health? And I'm going to start with you, Ngozi.
I always speak to, I'm going to look in the camera, I always speak to people living with dementia and care partners. And I want to say, as someone on this journey, that I hear you and I see you. And I know it's daunting, and I want to let you know that you're not alone. I want to let you know there are supports, there are services, there are people to help you. You can reach out, and this journey does not have to be as tumultuous as it can be. That's what I will say. Contact the Alzheimer's Society, contact folks, contact your healthcare provider, but you don't have to do it alone. That's what I say.
Absolutely. Laura, what would you want people to take away from tonight?
I think what got me started kind of in this whole field is the idea of giving back control about brain health. Is whether you have genetic risk or not, dementia is not an inevitable outcome. You have control over some of your outcomes, and not all of it. Some people will have dementia even if they do everything right, but you can reduce the risk, you can delay the onset, and you can live better even if you're diagnosed with dementia, right? So make those choices. And a lot of the things that are preventative are things that make for a richer life anyways, right? Being active, being social, connecting. Those are things that will make your day-to-day life better too. So feel that you have some control over that.
Dominik, what would be your takeaway message for tonight?
You know what? It's important to acknowledge that things are challenging in the healthcare system right now. That includes challenging for people and caregivers living through memory concerns, right? That's important to acknowledge. Things are challenging in the healthcare system. And at the same time, right now is the place to rebuild, to get our healthcare system back on track and get our system back to a place where we can be proud of a strong Canadian healthcare system again. It starts by advocacy. It starts by us reaching out to our elected officials, our MPPs, our provincial parliament members. They're responsible for healthcare. And my yearning is, let's have this conversation again in a year, in 2 years, in 4 years. And my hope is by then we can start being proud of our healthcare system again. So right now, too many people are feeling that stretch and are feeling those gaps, including in memory care. But we can get to a place where we have a strong Canadian healthcare system, including in Ontario.
Well, on behalf of the Ontario Brain Institute, I want to thank you all for sharing your time and your insights today. I don't know how to summarize all of this, but I will try. I think we've learned a lot about memory concerns and cognitive impairment tonight. We've learned a lot about new topics such as social prescribing. We've learned how to sort of navigate the healthcare system and a lot of resources that exist, including what to do when you don't have a family doctor, including hope for the future that will only happen if we continue to advocate, if we speak up for those who can't, or for your own experiences that you're living through today. So I hope that you'll take away a lot of this tonight. You'll think about it, you'll share it, and you'll talk about it with your youth ambassadors, with your friends, family, strangers on the bus, although maybe read the room first before you do that. But sharing it is the way that we'll be able to, stop keeping sort of elder brain health as something that is a secret, that's something that's stigmatized or something we're scared to speak up about. Instead, normalize it, because we are all aging. There is normal, healthy aging, and there are cognitive impairments. And only if we speak up about it is that how we'll know when to recognize it, when to ask for help. I also want to thank all of you for engaging with this talk tonight. There were so many questions from online and from here, and I hope we were able to answer a lot of your questions. And if not, I'm sure some of the panelists will still be around for the next few minutes, so please do ask questions. There will be resources to share after this talk. Some resources are going to be shared on the screen shortly, and they're also going to be available on the Ontario Brain Institute's website, so that's braininstitute.ca under resources, and you'll also be able to find a recording of tonight's talk if there's any particular part that you want to return to. And I'm just going to make sure I haven't missed anything else. And we also have a few handouts here. So there's a survey for your thoughts. We've also got a survey link in the chat box for people tuning in online. And for those of you joining here in person, you've got a printed copy, as well as, I think, a list of resources too. So the Ontario Brain Institute public talks are designed to share the latest knowledge on brain health and offer simple tips to manage both health and wellness. The next talk is called Exploring the Brain-Gut Axis. It's the first in the Breakthroughs in Brain Science series. It's set for June 5, 2025, so it's going to be warmer weather, and we'll hopefully see you then. Thank you all for coming, and good night.